There's one condition in the shoulder that severely limits the patient's motion that we'll often call frozen shoulder. The medical term for that is adhesive capsulitis, and it's where the shoulder literally starts to get socked in with scar tissue and the patient loses motion. There's a number of different conditions that may predispose a patient to having that. An episode of trauma can contribute to it. Patients who are diabetic or patients who are smokers are much more predisposed to that. We do see it more often in ladies than we do men. Whatever the condition is that contributes to it and causes it, it goes through kind of a similar process. And the first part of that process is called a freezing stage. And during that freezing stage, the patient's losing motion and it's literally getting tighter and harder to use that shoulder. And interestingly, that freezing stage is usually kind of painful, and it can be painful even with the patient just at rest and not using their arm. And during that freezing stage, patients are sometimes pretty miserable and uncomfortable. During the freezing stage, we'll often try to interrupt that pain process with things like injection and physical therapy, and we can get some pretty good relief with that. Once the shoulder is completely as stiff as it's going to get, then it goes through what we call the thawing phase, and it'll start to loosen some, and the patient will start to get some motion back with that. And interestingly, the pain is actually less during that stage. However, to really get the motion back without any type of intervention like surgery can take a really, really long time, like many months, and sometimes we even refer to it lasting more than a year. There are things surgically that can be done to interrupt that cycle, and occasionally a patient's a candidate to do something like arthroscopy, where we go in and we cut the scar tissue, or sometimes we do something called a manipulation, where instead of doing actual surgery on the shoulder, we just put the patient to sleep and we move that shoulder and all the different pathways to get that scar tissue broken up. Either way, the goal is to get the patient's motion back, to get their pain under control, and sometimes we use surgery, and we almost always use physical therapy.